COVID-19 is no respecter of equality. You only need to look at these photos to see that. So what would have happened in the first wave if white people had faced the same risk as those in black communities? Two leading think tanks today say 58,000 more people would have died in England and Wales. Equally starkly, taking out the effects of age and sex, they estimate that at least 2,500 black and South Asian deaths could have been avoided.
Our research finds that actually underlying diseases like diabetes or cancer or lung disease aren't explaining what's happening here. They explain only a sliver of what is a massive inequality or risk disparity. Okay? Other people have looked to use genetics to explain what's going on. But again, the evidence is clear. Race and ethnicity are concepts defined by society, not by genes. And so the reasons why race and ethnicity are determinants of COVID outcomes are societal, not genetic.
There are the statistics to back up the report's findings. 24% of Bangladeshi households and 15% of black African households are classified as overcrowded, compared to only 2% of white households. Non-white patients are often sicker when they arrive at A&E. Black patients, 55%, and South Asian patients, 35% more likely to need resuscitation or very urgent care than white patients. Housing, healthcare and employment, all pointed to in the report. Ranjith Chandrapala was a bus driver from West London. He died from COVID on May the 3rd. His route had started and finished at Ealing Hospital.
All of the bus drivers that I think of in, my dad's garage, there's definitely a high proportion of, BAME workers there. And I think that they were just used like fodder, really. They were asking for better PPE, they were asking for better safety measures, but there was such a pushback, I think. And why is that? It's because is it because there's a lack of respect for our communities?
30 bus drivers in London have died from COVID-19, and today Transport for London said they had followed Public Health England guidance throughout the pandemic and would do everything that is humanly possible to protect workers and customers, while the government said measures had been designed to protect and support everyone, including our most vulnerable. This is not the first report to highlight the disparities and who is being affected by COVID-19. In June, we had the Public Health England review, which some people were disappointed in because it didn't go into some of the underlying structural problems. And the government itself has ordered a review into that review. But this is not action. And the IPPR and Runnymede Trust both say that what is needed right now is action. And so they say this should happen. Include ethnicity as a risk factor when deciding who should be tested, offer temporary accommodation to people who need to isolate if they can't because of their living conditions, and ensure isolation pay support is available to all, including those without immigration status.
There's the issues about funding and how we allocate funding so that those people at greatest risk get the greatest impact and get the greatest measure of intervention. This is a leadership question as well. It's about who leads these programs and ensuring that we have representation of black and minority ethnic groups around the table when decisions are being made.
There are more facts and figures, of course. Public health cuts, for instance, in 10 of the most ethnically diverse areas in England and Wales. But in the end, this is what it means. Ranjith Chandrapala was only 64. He was loved and popular, and he has left behind a grieving family.
Well, I'm joined now by Gwynetta Curry, who's a specialist in race, ethnicity and health at the University of Edinburgh. Do you think, to look at those action points, black people should be prioritised over white people when applying for a test?
I don't think it's a matter of prioritizing black people over white people. I think it's a matter of giving equal access to testing for all groups.
But don't we have that at the moment? I mean, there is no race distinguisher when you go onto the testing website. In order to address the structural problems that have led to more black people being at risk, this suggestion is, well, maybe that should be taken into account when it comes to trying to get a test.
Well, I think the problem that we have there when we talk about prioritizing or listing race and ethnicity as a risk factor, it will lead to more discrimination towards that group. What we know, I'm from the U.S., but what we know, it leads to targeting of that group. We know that these communities are lacking resources. So if we know that deprived areas are overrepresented in ethnic minorities, we need to make sure that all areas, including deprived areas, have access to testing as well as healthcare.
So what kind of action do you think could be taken quickly as we
Yeah,
go into
quickly.
this winter?
Well, quickly, I think that the recommendations that were outlined were pretty reasonable. I think that front-face workers need to have access to PPE. I think there needs to be implementation for people to be able to self-isolate when they live in crowded housing. So those are some major things that could be done fairly quickly.
You'll have seen the debate around this over the course of the last year, with people saying, well, fine, if you want special measures for ethnic minorities, what about special measures for men? Because they are overrepresented. I mean, do you think we need to look at these different groups of people the same way, or is there something different about the BAME population?
I think it's interesting that people have issue with looking at this population. I think that it's important to know that there's nothing inherently different about racial or ethnic groups. It is the way the society is structured that it's disadvantaged those groups. So I think it's a matter of fighting for equality and more of an equitable society, and that includes men.
And that is obviously a very long-term problem, which gives politicians an easy get out, which is to say, oh, these things take years and generations to solve.
Yes, but there's some immediate things that can happen. You know where the deprived areas are. You know who are being disproportionately affected right now. You need to implement measures to protect those groups. So make sure they have adequate PPE. In the segment that you just showed, it was evident that the bus drivers did not have adequate PPE, even though they requested it. We have to understand why that is happening. Why are they being left out there exposed?
You say you're from the States. Do we have the same problem as the United States when it comes to this?
The numbers are very similar. Looking at the data from the US, Black and brown populations are disproportionately affected by COVID-19, and it's very much linked to where they live and where they work, same as in the UK.